my name is Michelle. I'm going to be your nurse practitioner today.
Hi.
Can you tell me your name and date of birth, please?
Barbara Ritchie, January 7th, 1996.
Good. And what's today's date?
October 15th, 2023.
Awesome. And where are you right now?
The clinic.
Very good. So you appear to be A&O times 3 to me. You're well dressed. You look well nourished. Your hygiene is good. So that's all good. So we're going to go ahead and get started with your physical assessment. Can you lay down on the table for me, please? I'm going to start by inspecting your abdomen. Okay. I'm going to pull this up a little bit. All right, so I see that your abdomen is nice and flat. It's symmetrical. I don't see any ecchymosis. I see no masses. There's no distension. I don't see any peristalsis, so I don't see any signs that lead me to believe that you have an abdominal obstruction, which is good. So first I'm going to auscultate all 4 quadrants of your abdomen. I'm going to auscultate each quadrant for 2 to 5 minutes. I hear high-pitched gurgling sounds, which is what I want to hear. And I hear them at a rate of 5 to 30 per minute, which is normal. So now I'm going to take the bell of my stethoscope and auscultate your aortic artery, your renal arteries, and your iliac arteries. Good, so I don't hear a bruit, I hear no vascular hum, which is normal. Now I'm going to percuss all 4 quadrants of your abdomen. Okay, and I hear tympanic sounds throughout, which is normal. Now I'm going to test your CVA. Can you please sit up for me? Do you feel any tenderness?
No.
No tenderness?
No.
Good. So I'm going to have you lay back down. I'm going to percuss your liver. So I'm going to percuss upwards until I hear dullness, which is right about there. And then I'm going to percuss downwards to find the top margin. Dullness. Okay, good. So your liver seems to be about 10 centimeters, which is the appropriate size. So I don't see any sign of liver enlargement. So now I'm going to see if I can percuss your spleen. Yep, so that's where I would expect it to be, so no spleen enlargement. So now I'm going to lightly palpate all quadrants of your abdomen. Do you feel any pain?
No.
Good. I'm going to deeply palpate all 4 quadrants. Do you feel any tenderness?
No.
Good. I didn't see any guarding. There was no muscle rigidity, so that's good, normal sign. Now I'm going to palpate your abdominal aorta. So it feels to be 2 centimeters wide, which is normal. I want it to be less than 3. I don't feel any pulsations, so I don't think that you have an aortic aneurysm, which is good. So now I'm going to palpate your liver border. I want you to take a deep breath. Okay, do you feel any tenderness?
No.
Good, I don't feel any masses. Your liver doesn't seem to be enlarged. I'm going to try to palpate your kidneys. Okay, so I can't palpate your kidneys, but that's normal. Sometimes you can palpate the right kidney, which it would be smooth and firm, but no tenderness, but I can't palpate either on you, which is also normal. So now I'm going to try and palpate your spleen. Do you feel any tenderness?
No.
Good, I don't feel any masses. I'm going to check for rebound tenderness. Do you feel tenderness when I lift up?
No.
Good, rebound tenderness is negative. Now I'm going to test Murphy sign. So I'm going to palpate below your right costal margin and have you take a deep breath. Good, so you were able to fully inhale. You didn't stop because you were in pain, so that's good. The Murphy sign is negative. Now I'm going to test your obturator sign. So I'm going to take your leg, move it inward and outward. Do you feel any pain?
No.
Good, so that shows me that you don't have any pelvic inflammation. Your appendix is not ruptured, so that's all very good. So I'm going to have you sit up. I'm going to take a look at your upper extremities. I see that your clavicles are nice and apparent. They're symmetrical. I'm going to look at your scapula and your shoulders. They look symmetric. I don't see any joint swelling. I don't see any wasting of your deltoids, which is good. Now I'm going to palpate your joints, your sternoclavicular joint. Do you feel any pain? I don't feel any hollowing. Your acromyoclavicular joint. Feel any tenderness? No. Your elbow joint. Good. Your wrists, your fingers. Good. So I feel depressions felt between all joints. The joint surfaces are smooth. There's no masses. So now I'm going to start looking at your range of motion of your neck and the strength. So I want you to look left and right. I'm going to have you look up and down. And then I want you to touch your ear to your shoulder without moving your shoulders. Good. So that's appropriate range of motion. I want you to push against my hand. Good. Push against my hand. Push forward. Good. So your strength was appropriate bilaterally. Now I'm going to test your arm range of motion, or your shoulders first, actually. So you're going to shrug against my arms. Very good. I want you to bring your arms up and bring them all the way down. Good. I want you to flex your elbows up and down. And then you're gonna do it against my strength. Good, so you're strong bilaterally. I want you to go like this, move inwards and outwards. Good, I'm gonna have you supinate your arms. Very good, so your range of motion is all intact there. Now I'm going to test your deep tendon reflexes. So I'm going to start with your bicep muscle, right here. Good, so I saw your bicep muscle contract and your elbow contract. Now I'm going to do your brachioradialis. Good, so I saw flexion and supination of your arm, which is normal. And I'm going to do your tricep deep tendon reflex. Good, so I saw your tricep contract and your arm flex. So that's all normal. I would do that bilaterally. So now I'm going to palpate your pulses. Take a look at your radial pulse, +2 equal. Radial is +2 and equal, and your ulnar is +2 and equal. Very good. I don't feel any thrill. I'm going to palpate your hands. I don't see any masses. There's no redness. The temperature is normal. Your color is good. There's no clubbing. Your capillary refill is good. So now I'm going to test the range of motion and strength of your hands. I want you to make a fist for me and open. I want you to grip. Very good. I want you to move your wrist in and out. Very good. That's abduction and adduction of your wrist. And then I'm going to test the balance test. So I want you to go like this for 1 minute. Good. Do you feel any tingling? No. So that shows me that you don't have carpal tunnel. So that's very good. Now I'm going to take a look at your hips. So I want you to stand up for me. I'm going to palpate your hips. Any tenderness?
No.
Good. I don't feel any swelling. I don't feel any crepitus. I'm going to have you move your leg out, both of them. Good. And then inwards, across. Very good. I'm going to have you turn and move your leg forwards and backs. Good. Flexion, extension. Very good. So that range of motion is all very appropriate. Now I'm going to have you sit on this stool. I'm going to take a look at your lower extremities. All right, so I don't see any swelling, no redness, no ecchymosis, no discoloration of your legs. Your feet are appearing normal, your toes look appropriate. So now I'm going to look at your patella. It's smooth but firm, no tenderness, no crepitus. So now I'm going to test the range of motion and strength of your legs. So I want you to flex your legs out and in. Good. So you're able to flex and extend your knees. Your ankles, can I have you plantar flex and dorsiflex your feet? Very good, that's appropriate. And I want you to extend your toes and flex your toes and then fan out your toes. Very good, so that range of motion all looks appropriate. I'm gonna palpate your pulses. Popliteal is +2 and equal. Pedal is +2 and equal. Posttibial is +2 and equal. Very good, I don't feel any thrill, which is normal. Now I'm gonna test your deep tendon reflexes down here. First is your patellar reflex. Good, so I saw the contraction of your quad muscle and extension of your leg. Very good. Same on that side, and your Achilles. Good, so I saw your foot plantar flex. Very good. So that's equal on both sides and intact. Now I'm going to test your superficial reflex. So I'm going to stroke the bottom of your foot in an upside down J, and your toes curled inward, which is appropriate on both sides. Good, so that was an appropriate reflex. Now I'm going to take one more look at your abdomen. So I'm going to have you lay back down on this table, please. So I'm going to touch all 4 quadrants of your abdomen with a sharp object. Good. All right, so I see that your muscles contract when I do that, and your umbilicus moves towards the stimulus, which is appropriate. I'm going to have you stand up for me. I want to look at your spine. Okay, I don't see any kyphosis nor no lordosis. Do you feel any tenderness?
No.
I don't feel any masses, no increased warmth anywhere, which is all normal. I want you to bend forward and touch your toes. Check the range of motion of your spine. Lean forward. Good. And then I'm going to have you lean side to side, twist both sides. Very good. So your spine range of motion is intact. Now I'm going to test your cranial nerves. If you could have a seat again for me, please. So the first cranial nerve I'm going to test is cranial nerve 1, the olfactory nerve. So I'm going to have you pinch one of your nostrils and tell me what you smell in the other nostril, okay?
Cinnamon.
Good. And next.
Pepper.
Good. So cranial nerve 1 is intact. And I'm going to test cranial nerve 2, which is your visual field and your visual acuity. So I'm going to have you read from the Snellen eye chart the lowest line you can while covering one eye.
PQRST.
Good. And cover the other eye.
PQRST.
Very good. So now I'm going to test your alignment of your eyes. So I'm going to shine this light in your pupil and make sure it reflects on the same spot in both eyes. And it does. That shows me that your eyes are equally aligned. There's no sign of strabismus. And then I'm going to test your peripheral vision. So I'm going to have you close one eye, cover one eye, and I'm going to have you tell me which number I'm holding up in each quadrant.
1, 2. Sorry, 3, 2.
Good. And other eye? Yep, don't move your eye, just look at me.
1, 2, 3, 2.
Very good. Your peripheral vision is intact. That was optic nerve, cranial nerve 2. So now I'm going to test cranial nerves 3, 4, and 6. So I'm going to do the 6 cardinal fields test. So this is going to be testing your parallel and conjugate movements of your eyes. So follow this object with your eyes and not your head, okay? Very good. That was appropriate. And then I'm going to test your convergence. Good. So your eyes moved inward and with the object. That's appropriate. Now I'm going to test your direct pupillary reflex. So I shine the light in your left pupil and the left contracts. I shine the light in your right pupil and the right contracts. Now I'm going to test your consensual pupillary reflex. So I shine the light in your left pupil and the right contracts. And I shine the light in your right pupil and the left contracts. So very good, that's appropriate. Your pupils are both equal, round, and reactive to light. I don't see any drooping of your eyelid. I've been observing you blinking. You're blinking normally, your eyes fully closed when you blink. There's no ptosis and you're not excessively blinking, which is all good signs. Now, I'm gonna actually defer testing the doll's eye reflex since you're fully conscious. So now I'm going to move on to cranial nerve 5, the trigeminal nerve. So I'm going to test your facial sensation. I'm going to swab your different parts of your face with a sharp object and a dull object, and you tell me which I'm doing, okay?
Mhm.
So this is going to be dull, this is going to be sharp, okay?
Sharp. Dull. Dull. Sharp. Dull.
Good. Next, I'm going to have you clench your teeth, and I'm going to palpate your masseter and your temporal muscles. I want you to pretend like you're chewing. Very good. So I didn't feel any muscle spasms. You don't have facial paralysis. You moved equally and with strength on both sides. So now I'm going to test cranial nerve 7, which is your facial movement. I want you to raise your eyebrows for me, smile for me, frown for me. Close your eyes, open them against resistance. Very good. So you're moving your face equally on both sides. There's no facial drooping, nothing like that. So now I'm going to test cranial nerve 8, which is your hearing acuity. So I want you to tell me if you can hear the sound and tell me when it stops, okay?
Mhm.
Can you hear it?
Mhm.
Tell me when it stops.
Stopped.
Can you hear it?
Mhm.
Tell me when it stops.
It stopped.
Good. And the other side? Can you hear it?
Mhm.
Good. Tell me when it stops.
It stopped.
Can you hear it?
Mhm.
Tell me when it stops.
It stopped.
Good. So that was testing your bone conduction, your air conduction, which were both intact, but the air conduction was longer, which is normal. So now I'm going to do the Weber's test. So tell me if you can hear the sound equally in both ears.
Yeah, I hear it. Both ears.
Okay, good. So your hearing is equal on both sides. Very good. Okay, so now I'm going to test cranial nerves 9 and 10. I'm going to my pen light. I want you to open your mouth and say ah for me. Good. So your palatal arch rises symmetrically. I'm going to test your gag reflex. Good. Gag is intact. So now I'm going to have you swallow a little bit of water to test your swallow. Good. So you swallowed appropriately. I see that you're managing your oral secretions fine. So now I'm going to move on to cranial nerve 11, which is the trapezius and sternocleidomastoid movement and strength. So now you shrug your shoulders against my arms. Good. I don't see any atrophy. You move them equally. They were equally strong on both sides. There's no vesiculation. So now I'm going to have you turn your head from side to side against my hand. Good. Good. And move forward against my hand. Good. So all your movements were intact and equal bilaterally. So now I'm going to test cranial nerve 12. So I want you to stick your tongue out. It's nice and midline. I want you to move it left and right. And I want you to move it against my fingers. Left and right. Very good. So your tongue strength was appropriate. It's midline. There was no weakness. I want you to repeat the sound la.
La.
Good. So your pronunciation of lingual sounds is intact. So now I'm going to take a look at your coordination. So I want you to hit your palm of your hand on your thighs and then the top of your hand. Yes, and go back and forth as fast as you can. Good. So your rapid alternating movements are intact. You were able to do it rhythmically and quickly, which is normal. I want you to take the heel of your foot and rub it in a straight line down your shin. Good. And the other one. Good. So you're able to do that in a straight line, which is normal. I want you to close your eyes and touch your finger to your nose on both sides. Good. So you were accurate and your movements were smooth. There was no arm ataxia. So now I'm going to test your exteroceptive sensation. So I'm going to lightly touch you on one side of your body or the other and just tell me which side of your body, left or right, I'm touching, okay?
Left, right, left, right, left, right, right.
Good. Okay, so your light touch is intact. I'm going to test your superficial pain. So I'm going to touch you with a sharp or dull object. So this is going to be sharp, and this is dull, okay? So just tell me if I'm touching sharp or dull.
Okay. Sharp, dull, sharp, dull, sharp, dull.
Very good. Okay, and then I'm going to test your temperature sensation. So this is hot. Can you feel that? And then this is cold. You're able to differentiate? Okay, so just tell me which location I'm touching with, either hot or cold.
Left forearm hot. Right upper arm cold. Left ankle hot. Right ankle cold.
Very good. Now I'm going to test your proprioception. So I'm going to have you close your eyes and I'm going to move one of your fingers up or down and you're going to tell me which way I'm moving it.
Up.
Good.
Down.
Very good. So that's intact. I'm going to test your vibratory sense. So I'm going to have you put out your hand and I'm going to ask you, can you feel this vibration?
Yeah.
Tell me when it stops.
Stopped.
Good. Do you feel this vibration? Tell me when it stops.
Stopped.
Very good. So you have your vibratory sense intact. That shows me that you don't have peripheral neuropathy, which is good. Now I'm going to test your cortical sensation. So I want you to close your eyes. This is going to be the sternosis test. So I'm going to put an object in your hand and you're going to tell me what object I'm putting in your hand. Let's see if you can identify the object.
Coin.
Very good. And this object?
Hair clip.
Very good. So that's good. Able to identify the objects. Now I'm going to do the graphesthesia test. So I'm going to trace a number or a letter in your hand. You're going to tell me what I'm drawing.
A.
Good.
8.
Very good. So that's positive. Now we're going to do the 2-point discrimination test. So I'm going to touch your finger with 2 points, and you're going to tell me when I'm touching with 2 or 1 points, okay?
2. 2. 2. 1.
Good.
2. 2. 2. 1.
Very good. Okay. Now I'm going to test for extinction. So I'm going to touch you on one area of the body or the other, either both at the same time or only one. So you're going to tell me where I'm touching or if I'm touching both sides or one side.
Both upper arms. Left arm. Right wrist. Both cheeks. Both ankles. Right ankle.
Very good. So your extinction is intact. Now I'm going to look at your balance and your gait. So I'm going to have you stand for me. You're able to move from a seated to a standing position fluidly and symmetrically. So I'm going to have you walk a few steps here. Good. I'm going to have you walk on your heels. And then I'm going to have you tiptoe. Very good. Your gait looks nice and steady and even. Your steps are symmetric. So now I'm going to test Romberg sign. So I want you to stand with your feet together with your eyes open. And I see you're able to maintain this position. So it's a negative Romberg sign, which is normal. Now I'm going to test your pronator drift. So I want you to stand with your palms upwards. And I'm going to see if your arms drift at all. I don't see any drift, so that's normal. And that concludes our assessment for today. Thank you.